interesting to hear what your experiences have been remaining open. And then 10% is other. And it looks like some have reopened. So I know a lot of us will be curious to hear how that has gone for those who have reopened. To start off with, we received a couple questions before today's engagement lounge. So let's start with one of those. Has anyone lost their library due to COVID? I'm curious if anybody would like to answer that question. And go ahead and raise your hand in that participant section, and we will call on you. If you don't want to raise your hand, you can type your question in the chat section, and we can, or your response, and we can let everybody know.
I see someone's responded from SCCA. I'm not sure what that is or where that is, but Lisa is reporting that the resource center there has lost its library. Janelle is reporting that ours is still closed, not lost, but still closed. I'm sorry, SCCA is Seattle Cancer Care Alliance. So they have had their resource center closed. Vanessa is reporting ours is still closed. Children's Hospital, Los Angeles.
I'm curious, for those who have reopened, would you be willing to share what changes you've made in order to do it safely, and what your experience has been?
I'd be happy to share. I can't find the thing to raise your hand. So, but I'm Annalise. I am at Levine Cancer Institute in Charlotte, and we reopened in June. Our resource center, we have limited hours, so we aren't open as long as we used to be. One of the biggest differences for us is that we are still not allowing any visitors at all. It's only patients allowed in. So that definitely takes out a lot of people that have been using our resource center. We do have restrictions on how many people can enter. Everyone has to wear masks. We now have staff in here anytime the doors are open. So we used to, would still leave it open if we went to lunch or anything like that, but now staff member has to be present. Whenever anyone comes in, they have to wash or sanitize their hands, have to be wearing a mask. Everyone gets screened when they come into the building for COVID, so they've all been screened by the time they get to us. There are a couple of programs that run out of our resource center. We have a gas card program, so that's really one of the main things that keeps patients coming in. And we do have wigs, which we are able to still provide, but again, that has to be on an appointment basis to give us plenty of time to sanitize, make sure there's not too many people in the space at one time. And those are really the main things that we have done. So our definitely usage is lower. Like I see someone's mentioning they're doing the same thing. But it's definitely really great for the patients that are able to come in to have a place to go and to get information. But we're also looking at other strategies to make us more virtual, since there are still a lot of patients that are doing virtual appointments instead of in-person visits.
I have a question, Annalise. So you reopened, but what are you doing about publications? Do you have brochures on display that patients can help themselves, or do you only give them to them, upon request? How are you handling publication distribution?
So our publications are still out and available. Since everyone has to hand sanitize when they come in, our infection prevention said that that was fine for them to take materials. So we just make sure that they are sanitized.
Anyone else who has reopened would like to chime in?
It looks like Kathy asked a similar question for those who have opened or are opening soon. Are you planning on displaying pamphlets and booklets on a wall, or will patrons need to request those and then a staff member will provide those? I'm curious to hear what the plans are for everyone. I know here at Huntsman, we have had topical displays throughout the hospital. It's my understanding, I could be wrong, it's my understanding that those have been taken down. The brochures that we keep in our learning center, we've always kept them in the back. And it's always been on a, either Will suggested it and bring it out for the patron, or they'll come in and ask if there's any information and we can provide those for them. So I know that that's what we're doing. Tina, it looks like you have your hand raised, so go ahead and unmute yourself and.
Hey everyone, I'll see if I can do video here. Oh,
there you go.
I'm from UNC and we've remained open the entire time, but with a limited staff. Most of our staff is remote, but our bilingual Spanish liaison and myself were here, and that was really important because we're the state hospital, and really we had to have a more proactive approach from the resource center, where we were the people who made the contacts in the infusion area to the patients because they were limited in their footprint. And then our other team members, we quickly started a navigation kind of support call program where fellow team members could identify a patient who might need, whether it's education, some type of support out in the community, and then we made calls. We had to train our lay navigation team to become a little more adept at making phone calls from this way, but we needed to greatly expand our staff at that point. So we have really virtually changed our entire care delivery model from the way that we delivered care before. And it's been interesting, and I think we're probably never going to go back to our original way. Like, we had to really skim down our hard copy library. It's just some basics that we have left. We do have the pamphlets and brochures still out, but patients will knock or call us, and then we bring them through so that we could limit how many people are in the resource center at one time. And then we pretty much assess, work with them, select things for them, but we're the ones touching the things. It's been a very distinct change for us. We also have other support services out of the resource center, like the boutique, and we have a nutritional supplement program, and we have massage chairs, things that we had to delay in the way that we allowed usage first and then have gradually opened it up. Our patients and families are starting to get a little bit antsy about everything at this point in time. And so I think that they need us more than ever. And we've just been adapting daily, but it's, I think that's what all of us have been used to doing in our professional lives anyway. So with everything, just keep changing daily. Yeah.
For those of you who are still closed, but maybe are gearing up for reopening, such as we are at Fox Chase, what changes are you preparing for? Would someone like to share the changes that they have in plan or maybe haven't thought of, or maybe are planning right now? Because our poll did show the majority, 48% are still not open.
It looks like Maritza has their hand raised. Go ahead.
Hi, everyone. I'm from Dana-Farber Cancer Institute in Boston. We are still closed and we do not have a reopening date as of right now. We're hoping for January, crossing our fingers at least. It's clear to us that when we reopen, it's going to look very differently. There's going to be a lot less educational materials out, at least from what infection control is telling us right now. Our capacity will also be limited to probably 1 staff member or 1 volunteer, and 2, maybe 3 patients tops. We have a large space. We're really lucky for that, but they haven't really given us strict guidelines yet. We're also planning on opening another location because we have a brand new satellite. So trying to plan that during this is incredibly challenging, not knowing what our original resource center is going to do. So we've really switched our focus to building out a digital resource center at this time. So putting all of our pamphlets and brochures and anything that was physically in the center online. So that's what we're currently doing. It actually launches tomorrow, which we're very excited about. But it's clear to us that it's a change for the foreseeable future. So we'll obviously have to figure out an in-person method, but we're also moving towards more digital content.
Thank you for that, Maritza. I see there's a chat comment from Kirsten in Toronto at Odette Cancer Center. They're planning on reopening soon using an information desk style, where team members will sit at the front of the resource library and get the resources for patients. They're waiting to receive plexiglass to minimize contact. At Fox Chase, we will be using plexiglass around our desk, and that is one of the first steps in our reopening process. Would anyone else like to share?
So we actually just received some bullet points of the changes that we will most likely be making once we reopen. There's still discussion going on with it, but one of the changes will be that our hours will be reduced. We used to be open 8 to 5, and the door was open that whole entire time. Now we will be open, we'll have someone available. I believe we're going to be keeping the door closed with a doorbell outside of our center and a phone number to call if one of the health educators is not in the learning center. But we will be open 9 to 12 and then 1 to 4. And then that 12 to 1 hour, we will do a cleaning of the entire center. Patrons used to be able to just browse freely, put books back, take them out. We will be the only ones handling materials until they are checked out to a patron. We'll be limited in the amount of people we can have in our learning center. We also kind of doubled as a business center because we have 3 computers in the back of our library, along with a printer. We will be able to print things out for patrons and fax items, but we're really going to be limiting the amount of time people either spend on the computers, or we will do all of the computer work for them. So those are some of the changes that we're making. And I believe we've been checking items out this whole time, but that's really dropped significantly since people aren't in the learning center. But once the items come back, I believe they'll be quarantined for 72 hours and wiped down before being available again to check out.
I see a question in the chat from Annalise. For those doing digital and online, who is helping you create this? Are you doing it through your hospital website or something different? Could someone please comment, anyone who's doing a digital library?
I can say for us at Dana-Farber, we're using our database, we use QuickBase, and I actually have been using it for the past few years for our other programs and was able to build it out for us. Our volunteers are also very familiar, so it's easy for them to update the resources on there. So a link to this database will be on our Resource Center webpage, and patients can access it from there. We're also looking into having a digital library where patients can check out ebooks and audiobooks and other content like that, that will also be available on our website.
Thank you, Maritza. Anyone else care to comment on a digital resource center?
It looks like Leanne has her hand raised. Leanne, would you like to comment, or if you had another question?
Yes, hi, I'm Leanne Hallback from the Christiana Care, Newark, Delaware, Helen F. Graham Cancer Center. We opened up in July, but it was with a lot of preparation, a lot of restrictions. So what we did was we put painter's tape across some chairs with a sign asking people not to use that chair. We took away some chairs to be able to, minimize the chance that somebody might use them. We have the hand gel right at the front door. We screen them, take their temperature as soon as they come to the door. We did separate the PCs, the usage for the PCs, and shut off some of them and put, this is not being used, this PC. So that was really helpful with keeping people separated. And the other thing is too, is that we're like always cleaning. So once someone leaves, as soon as they leave that computer station, I go over there with my gloves, I use that germicide wipe and totally clean that PC area. And then I put a yellow piece of paper saying that this area has been sanitized. That's been helpful. We also got those circle things on the floor that say, please stay 6 feet apart. That's been helpful that it's been giving people a visual. The other thing that we did was we put a book cart in front of the circulation desk, and that is giving us like a separation space so that people aren't tempted to get closer to the counter, because that's hard, and we don't have an acrylic template, clear board. We don't have that here. The other thing is, you guys were talking about, you also have to wear a mask and clean your hands before you come in. That's a must. We did close our hours down to closed on Friday, but open Monday through Thursday. And I still put out the brochures on the brochure racks, although nobody else has any brochures out. But people are still taking them. I actually found Conquer, the journal Conquer. It's a free magazine by Greenhill Health Communications, and it's specifically for patients with cancer. They have delivered our issues individually wrapped. So I found that really interesting that they were thinking ahead, and none of the other like patient resource, literature that we have, and some of the other cancer magazines that are handouts, they just come directly like they usually do. The other thing I wanted to tell you is having like two separate containers for pens. We have one that's a clean pen cup and one that is used. So we're letting people know that we're cleaning the pens after their usage, and they're getting the hang of that too. So other than just like constantly cleaning and screening and practically covering everybody when they're coming in, it's going okay. My numbers are down, but I'm still getting a lot of electronic requests and staying busy. Thank you.
Thank you so much for sharing that information. I'm seeing a lot of questions and comments come in through chat. I can share some of those with you. So at MD Anderson, they work with the electronic health record team, and now there's an Ask the Library selection on the patient portal in their electronic health records, and they also implemented a chat function. So everything's digital, but they're able to reach the patrons better than they were. Some items about infection control from Angela in Hamilton, Canada. The fabric chairs were removed, and chairs that can be wiped are being used, and they no longer allow access to their public computers for patients and families. And others have covers being wiped only. So at Fox Chase, for example, we do have public computers, and we do have a charging station with 6 different units, and they all require someone to put their numbers on the keypad. So that's been closed as the resource center in mid-March. So I was wondering if others have a lot of touch surfaces similar to that when they did reopen, or you're planning on reopening. What are you going to do in addition to the publications, all the other surfaces, such as the computers, the phone chargers? I love the idea of having a separate pens, things like that. Does anybody want to comment on that?
I'll just comment real quickly because I noticed there was a question that kind of goes along with this in our chat, and it asked, how do you wipe down your books or materials that you have in your learning center? And at Huntsman, we cover all of our books before they are available and put out on the shelves. So there is a plastic covering on all of our materials, or the CDs and DVDs already have that plastic covering hard case that we can easily wipe down with alcohol wipes. We have computers. We do have public computers. I am not sure if they will be available or not. If they are available, we would make sure to wipe those down between each patron. But if anybody else has any insight as to how you are cleaning your high touch areas, that would be really helpful.
Okay, well, if there's no further comments on that, we can shift gears a little bit. For those who are doing remote, all virtual, we're curious what online platforms everyone is using. We had some discussion at our last session that we held in May. A lot of people are using Zoom. Sometimes there's privacy concerns, with patients using Zoom. Some are using Microsoft Teams. There might be other platforms. At Fox Chase, we have switched to an all virtual format for our monthly patient education sessions. What we're finding is we're getting more attendees. It's very popular, open to everyone. But I was wondering what else those of you who are still all remote might be doing virtually. So far, we've heard there's digital libraries being created. So how about we hear from some others about online platforms and what services you're using virtually. And also, how are you reaching your clients, your patients, and their family members, and telling them about your virtual services? Okay, Maritza from Dana-Farber said all their programs are on Zoom Live, and they're recording sessions, and they use, as she mentioned, QuickBase for their digital resource center.
And it looks like Leanne has her hand raised. So go ahead, Leanne.
Sorry, hi. I was just wanting to let you know that I usually have a quarterly newsletter that we send out to patrons that have signed up for this. And I did send out a email to our patrons letting them know that even though the building, if you are coming here as a patient, you can come into the library, but visitors are still being told they need to not come in unless they are with the patient that is unable to move around on their own. So that newsletter, or that newsletter list of emails was a great way to get the word out that we are open, or they can call in and we can mail things, or they, if they can't come in. That's all. Thanks.
Would anyone else like to share how they get the word out about their virtual services and what programs you are offering virtually? Okay, some comments on the chat. So from Kathleen, they have a monthly newsletter also as part of patient and family support services that's mailed and also online. And they're going to start online education centers in October, and will advertise through, says the Navigator. From Canada, due to concerns related to privacy on various platforms, and in the interest of ensuring use of any virtual initiatives into the future, they've opted to compile more than one video series from different sources to cover information they would typically provide in in-person education sessions.
And Rebecca, I saw that you raised your hand in your video. Go ahead and unmute.
I was just going to say that we tried switching to Zoom, but our population, rural, elderly, lower socioeconomic, we had very poor response to our classes on Zoom. So what I've done is converted them to a YouTube video. People are a little bit better able to, sometimes I have to text it to them. They don't even use email, but they have a phone that they'll receive a text, and if they click on the link, it will pop up the YouTube video. That's not ideal. It's not, it's not the same as having something that's more interactive. And we have another program that we offered on Zoom, a patient empowerment program that we had like 4 or 5 people. We're going to try it again this fall and try to get more, but the access to Zoom or any kind of interactive online stuff is a real challenge, and I'm curious to hear what others have experienced in trying to switch to Zoom.
At Fox Chase, we have been using Zoom, as I mentioned, for all our patient education sessions, and that seems to have been going very well. Our patients seem to have adapted to it well, and there haven't been privacy issues. We don't show video, that's all blocked, and there's no voice nobody is actually speaking other than the presenter. So Zoom's been successful for us. Others?
Well, at MD Anderson, we started using Zoom recently for definitely the social work department is using Zoom for support groups, and they started that early on, and it seems that it's going well. There's a nutrition class that was in person, and it quickly moved into using WebEx platform early on, and there's a good system in place so they can schedule patients, and again, the attendance, it's there, but it can be increased, as I heard. And they're transitioning from WebEx to Zoom. There are at least 2 other patient education chemotherapy specific education for a couple of clinics. Then they understand that there are, one was actually in person and is transitioning to Zoom virtual, and the other one is new and working on to start that also in the breast center to offer a virtual class ongoing. So it's working, and we have other presentations for patients from the volunteer services that the Learning Center is involved with, and those are very successful, and they're using Zoom platform as well.
So reading in the chat, it seems like quite a lot of you do use Zoom. We have a few people that do use WebEx. Vanessa says we use WebEx as well and emails the links and passwords out. Someone else has moved or support groups and wellness classes to Zoom, but attendance is still lower than when the classes were held in person. At Odette Cancer Center, Zoom is used for patient education classes, such as chemotherapy and lymphedema and events. The patients are emailed if they provide us with an email address. If not, patients are called to see if they have an email. They also have low attendance and are working on creating recordings of the classes.
And
oh, go ahead, sorry.
no, that's okay. Maritza has her hand raised, so go ahead.
Yeah, sorry, I keep interrupting you guys. So our resource center actually had a 300% increase when we switched to digital programs. I too thought that our Zoom numbers were going to be a lot lower. But I think that because all of our virtual visits were over Zoom, the social work visits were over Zoom, even our Zachem Center, which was integrative health, was switched to Zoom. Patients got used to it. They also had teaching sheets and video tutorials that were integrated throughout their care. So I think they just became comfortable with the platform, and as time went on, continued to find more resources to join. But we also had our volunteers supporting patients and downloading Zoom with them. So if patients have difficulty joining a webinar, we give them the option to email us ahead of time, and then we have a volunteer call them to help set it up. So we've put in methods to kind of counteract some of the technical difficulties. It still happens, you know, people still have difficulty joining, but we at least have the support there if they need it.
Thank you. Leanne is telling us on chat that the Look Good, Feel Better program, that's from used to be from the American Cancer Society. I don't believe they're running that anymore, but now that is offered virtually, and they mail the skincare makeup kits to the patient. Anyone else who is currently all remote would like to share some of their processes, staying and keeping their patients engaged with the resource center? Anyone who has peer mentoring programs through their resource center, how you're keeping your volunteers engaged now that everything is virtual for your program? Would anyone like to share that?
I would like to share some information about that and what we do at MD Anderson in the Learning Center. So as far as keeping in touch with our volunteers, we have aspired to do weekly calls, but sometimes it's bi-weekly, but we constantly are in contact with them and you know, just making sure they're doing okay and they're in touch, and that seems working to be working. And as far as being in contact with our patrons, we recently added 2 new online virtual services, if you will. One is a text service and chat, online chat during our working hours, or business hours rather, 9 to 4 Monday through Friday. And that service started a little bit over a week ago, 2 Mondays ago. And we also added another service through Epic, my chart, that patients can email the Learning Center with information, health and cancer-related information needs and resources needs. And that is working very good. I believe we get different types of questions, not all related to cancer information. Somehow indirectly is related, but not directly all the time. All the questions are about resources and specific cancer information, but it's working good. I believe. I don't have the data, the full data to share with everyone, but if you're interested, we can discuss that later, or email me, or anybody who's from MD Anderson who's present at this webinar can help as well.
Some comments in the chat about volunteers. So Carol's reporting that they lost access to their Canada volunteers due to the border closing. In Hamilton, volunteers are not allowed back to the Cancer Center as of yet, with no plans as to when this might change. Rebecca from Chico, California, volunteers in some positions with changes for COVID coming back in October. And then Leanne's reporting volunteers are not allowed back into the entire hospital system yet. So I think that's an issue for everyone. Volunteers not being allowed in. At Fox Chase, we were facing the same situation, limited use of volunteers. But our volunteers for our patient-to-patient mentoring program are still fully active because that was all remote to begin with. That was not an in-person program. John is reporting we can't use volunteers or work-study students. Annalise is reporting volunteers are only allowed between the ages of 18 to 64 without certain health conditions and in limited non-patient facing roles. So it looks like volunteers are very limited in almost all institutions, and that probably will continue to be an issue for some time to come. MD Anderson, no volunteers are allowed at all. And Dana-Farber, Maritza is reporting that their peer support and PFAC has been active all along, and their interns are working remotely. The same with Fox Chase. Our peer support program has been very active, and our PFAC also, Patient Family Advisory Council, have been very active all along, even during the closure.
I'd be curious to hear some changes that centers have had to make that you think will continue on once we either quote unquote return back to normal or once your center has reopened. I know for us, we're all working remotely, which we didn't do pre-COVID. And I think especially reopening while the pandemic is still very much a factor, we'll continue with working remotely to facilitate our live chat and text to librarian services, also emails and phone calls. That can all be handled remotely while we have one person in the office, in the learning center to handle in-person requests. What other changes have your centers made that you think will continue? Would anyone like to comment?
This is Janine from Mayo in Rochester. Just a couple things that we've done. Initially, we made YouTube videos basically of our classes and put them on a patient support and online education information platform called Mayo Connect. And we link that through the portal or email or however we're connecting with patients so that they can go out and get information. We added a lot of digital information out there for folks and to look at. We're now, though, trying to really spend time on enhancing our digital presence and some of the ways we offer that service, I guess. And so we're trying to break some of those messages down into more attainable chunk messages, because like some of our videos were 30, 40 minutes. You know, people are watching them, but I do think that 5, 6, 8 minutes is probably a little more viable for patients and people to take a look at. So we're trying to figure out what are our key messages, how do we really chunk that message, how do we make it interactive, some of it video, audio, creative, and then also, you know, just written online as well. So that's what we're kind of working on. And our center is, the doors are physically shut, but again, we're kind of open also. We have people staffing in the education center, and people can either knock or call us, email. Our phone rolls over, and we have one of our patient navigators that really is wonderful at assisting patients for all needs, lodging, local resources, things like that, answers most of those calls. And then we're trying to just set up appointments for people to also teach some of our classes one-to-one or over the phone. And hopefully soon we'll do some more Zoom classes as well. Thank you.
Thank you for that information, Janine. I'm curious, for those who are putting together videos, are you working with your communications department? Are you doing it on your own? And also, I'm curious what you're using to put those videos together, what programs?
Right now I'm using a Zoom recorded session with a shared screen PowerPoint presentation, and because it's economical and will be pretty easy to make changes as I figure out exactly, as I tweak them. The expense of creating videos, we just don't have it in the budget at $1,000. I think it'd be $1,000 for a 5-minute video or something. It's not going to happen here.
At our work, I'm at Be the Match, and I know some of my colleagues have used something called Loom to record their education as video format. I don't know if anybody else has used that. It's spelled L-O-O-M. And she said it was fairly straightforward, where you could actually have the screen showing like your PowerPoint slide or your presentation, and then have like a little like down here in the corner, like a little picture of your head as you're talking. And so it like records you and has you on the screen while you're talking. And so she did, one of my colleagues who's a clinical trials navigator, recorded a educational session that way. It was just like 5 minutes long, but that seemed to work pretty well. I don't know if anybody else has tried that before.
Is Loom a free program, or is that something that you have to purchase?
We were able to use it for free. We were actually, I'm not entirely sure if it's free. It was something that we got to use for free because we were a presenter at a conference for the Fanconi Anemia Research Fund. And so they let us use it. I don't know that we had to log in. I'm not sure if it's free or not. So I'm kind of curious. I didn't use it. It's all like hearsay, so sorry. But I'm just curious if anybody used it and what their experience was. And it might be free or at least low cost, since this organization that was putting on this conference, they're pretty small as well.
Go ahead, Rebecca.
I noticed that MD Anderson is doing something with the animated education, and I'm wondering if you're using Doodly or if you have a whole team that works on that. I mean, you're so big compared to us, but I have someone who's really interested in switching some of our education over to this animation that you can create with an app. And I wonder if anybody else is using that. And I saw that MD Anderson has something sort of like that. It's, I think it would take some learning to learn how to do it, but it could be pretty effective if we took the time.
Hi, Rebecca. It's Sarah Christensen. I'm the Director of Patient Ed at MD Anderson. And we work directly with our Creative Services video team. So it's we're able to use their services to have animators create them and create the whole production. So you're correct. We're very fortunate to have that accessible to us. I think we only have about 6 videos that are done kind of in that animated style. A majority of the videos that we make for patient education are often a voiced over PowerPoint presentation. And again, we work with our creative services to create those, but they're pretty low cost and pretty effective.
Some information's come over at the chat about making phone calls from home. So a lot of you seem to use the Doximity app, DOXIMITY. It's a phone app that shows the office number when you're calling. So there, therefore, if you're calling from your own cell phone and people may not be as prone to answer it, it does show your office number. Someone did ask, can anyone talk about what types of classes you're offering virtually? I believe we had some discussion about that. Would anyone like to add anything about what else you're offering? Here at Fox Chase, we used to have in-person training for our volunteers who serve as mentors in our patient-to-patient network. Currently, we're doing phone trainings, so hopefully we'll transform that to Zoom. But anyone else have anything else to add about training volunteers or mentors, people that work with you, as opposed to classes, virtual classes? Anything additional with that? Okay, one comment here is they do a mix of things. The staff have recorded meditations and relaxation exercises using phones or tablets. iPhone voice memos are free and can produce decent quality recordings. Their community lectures are filmed by a professional videographer, and those videos are uploaded to our YouTube channel. So it sounds like people are using a variety of different means to get education out there, whether training their own volunteers or whether offering education sessions to the community. Okay, we only have about 4 minutes left. Are there any questions that people would like to ask of others, those of you who are either reopened or those of you who are planning to reopen or those who are going to stay remotely for the foreseeable future? Either put it in the chat or raise your hand.
Go ahead, Leanne.
Hi, I just wanted to respond to a question that I was asked because I think I can answer it faster than I can type it. Someone asked about learning more about our Writing is Healing virtual group. We used to meet, on site, obviously, patients and any survivors that would like to attend, but it is operated and facilitated, taught by a retired English teacher that's from our University of Delaware. And she provides the prompts for patients that really talk about self-healing, self-compassion, and like one other person was saying that the Zoom is not always available because of user inability of teaching. It's hard to teach someone virtually, but if they are pretty savvy with Zoom, they're able to attend free for an hour, and it's going well. I think I answered that.
There's a question in the chat whether the chat transcript will become available. Diane, are you there that you can answer that question? Is there a way to print this chat chain for later reference?
Yes, so the recording of this presentation will be put on the CPEN website, and the transcript will be available there as well.
I think we've heard some great ideas for virtual resources. Somebody did say, I hope there will be a summary made to share with all of us. So as Diane said, the transcript will be there. It's wonderful hearing from all of you, both those of you who are reopened and those of you who are have plans to reopen. Because I think our situation will remain as is as far as the pandemic for a while. Nobody really knows, but it's so great to share these ideas with everybody.
Yes, thank you everybody for joining us today and for sharing your insights. Be sure to watch your email for information on upcoming CPEN Engagement Lounge topics. And also, if you would like to continue this discussion further, if you are part of CPEN or would like to become a member of CPEN, please feel free to sign up. We have special interest groups that you can join. One of our interest groups is Learning Resource Center group, and it's been rather dormant lately, but we're gonna get going again here. So if you wanna sign up, an email will be sent out to everybody on that group list for an upcoming phone call. I hope you all are doing as well as you possibly can, and stay safe, everyone. Thanks for joining today.
Thank you for joining us today. It was a pleasure talking to you all. Have a nice afternoon, everyone.
Bye-bye.